Inflammatory Breast Cancer Foundation presents IBC, Facts and Fallacies, What Your Doctor May Not Know. In today's world, the internet is used by so many. Research is at its fingertips of just about anyone on subjects they may need to know more about. But the challenges of knowing the truth versus fiction about health issues are a major concern for the public and the medical community. With all the hurdles many women face when they may have the symptoms of IBC, and the doctors who seemingly disregard their pleas to rule it out, this show will attempt to educate everyone and help differentiate between what really are facts and what are fallacies. And now, your hosts for tonight's show.
Good evening, everyone, and welcome to our show tonight. We have Dr. Massimo Cristofanilli with us tonight, and I'm going to divert a little bit instead of going to my usual speech in the beginning and introduce you to Dr. Cristofanilli. How are you, doctor? I think we have a technical difficulty.
I can hear you.
Okay, how are you this evening, sir?
Pretty good. Thank you. How are you?
I'm great. The first 10 minutes here that we have are 15 before our first break, because we are now going to be on YouTube for the first 10 minutes of our show. You want to tell us about the global meeting that you're going to be attending next month?
Yes. So this is the second Inflammatory Breast Cancer International Conference. It's going to be in France, in Marseille. And it's bigger than the first one because there are more physicians also from Europe. And I think we have a major goal. The first time we just met for the first time just to discuss about where we stand, what we have to do. And in fact, we just published a consensus statement about what the minimum should be done for inflammatory breast cancer patients. But now, I think we have more research data to present. Several laboratory clinics have been working on inflammatory breast cancer, trying to understand the disease, to develop some new therapy, identify better target, a way to diagnose. Overall, there is a major effort. Last time, that was the first time, as I mentioned, we had put together the ideas of creating a global consortium to collect tissue, information about patients, how do they look like, what they have in common, blood, in order to develop some diagnostics. As you know, our major problem still remains to make a diagnosis in a proper time frame. And so this time we will reaffirm our support for this particular effort. We do have already collected a number of cases over the last 2 years. And I think there will be certainly some presentations that will show how much we know more about the disease. And I hope this is not going to be only remain a knowledge for specialists, but more also for the public, for the other physicians that never had the chance to be in contact with IBC and never heard about. And this is going to be, once again, published and will be common knowledge available, and will generate hopefully additional research ideas, additional efforts, hopefully to raise some funds and interest from pharmaceutical companies to develop new drugs.
I have one question that came in prior to the show tonight. What is your definition of inflammatory breast cancer? And given that there is no agreement on the definition of IBC, what do you propose as a strategy and timeline for nailing down the definition of IBC? Is that maybe part of what the global IBC group might be able to tackle?
Well, as I said last time that we met and we just published a consensus, there was an understanding that the definition is already there, just had to be clarifying a few issues, particularly the timing of the symptoms and the context of the symptoms itself. So this erythema, the swelling, the diffuse hardness of the breast associated with pain, almost the whole breast being involved, less than 6 months of symptoms. I think the definition has been discussed multiple times. At the end, what we presented were the data from the patient. How the patient present to the clinic
Okay.
will make a diagnosis of inflammatory breast cancer. You put all this together, you do have a definition. What the inflammatory looks like, what should be present in order to make a diagnosis. The problem is not that we don't know how the inflammatory breast cancer looks like. It's that some physicians don't think about it and don't do anything about it in spite of the evidence. So how do you convince the majority of the physicians that are not oncologists at that time, just maybe surgeon, primary care physician, OBGYN physician, that they need to think about it, they need to go back and read about it, take a photograph, like women do right now. I mean, they go on the internet and are able to find photograph of inflammatory breast cancer, and they go back to their doctor and say, do you think this is inflammatory breast cancer? Should I do a biopsy? And they do not do biopsy, do not go for workup because they don't believe it. So we know that this happens every day, and the question is what to do with it, because writing books, writing articles, it doesn't seem to be changing anything.
It makes my head want to blow up sometimes when I hear all this. So you are going to be able to accomplish quite a bit, I think. I call it Milan. Am I wrong?
No, it's Marseille. It's in France.
Oh, Marcel or Marseille? Teach me.
Depends which kind of language you want to use. Marseille.
Yeah, Marseille. Okay.
French.
Are you getting excited about the trip?
Yes, I think we're going to be, again, sitting together with friends that have a common goal, and we will be able to discuss for 2.5 days, and hopefully we'll be able the possibility of, again, to create new ideas and new research and new trials. One of the common things that happens in Europe, I'm sure you have understood this over the years, is that in Europe, women with inflammatory breast cancer don't seem to have the same voice that they have in the United States, even though this is mostly related to two major organizations here. But in Europe, this doesn't happen, and women just don't get together to ask for more research, to ask for more funds. Of course, it's a different health system as well.
That's true. We are going to go to what I'm going to call a YouTube break now, and when we come back, please remember our toll-free number. You can call in and talk to Dr. Cristofanilli. It's 1-888-572-0141. I'll say it one more time. It's toll-free, 1-888-572-0141, and we'll be right back with Dr. Cristofanilli.
Don't go away. We'll be right back with IBC Facts and Fallacies after a few short messages.